Hello, everybody. Good morning. I'm going to ask everybody to go ahead and start taking your seats. My name is Cecilia Oregón Echeverría. I'm the Executive Director for Kaiser Permanente's Institute for Health Policy, but you can call me Ceci. We have been doing these forums, these public events on public policy issues that we care about for about 3 years, and this is the first one that we've done outside of the Washington, D.C. area. So we're really excited to be here with all of you today. In particular, we're really grateful to the National Center for School Mental Health for their partnership and letting us do this pre-conference session with them, as well as to the Healthy Schools campaign and the Alliance for a Healthier Generation, which really lent a lot of thought partnership to how we coordinated today's event. So a little bit of housekeeping. You all have a folder in front of you. The folder has a 2-pager on ACEs and trauma and includes our agenda. And importantly, I think you will also find the Wi-Fi password and some of the hashtags that we'll be using today on Twitter. So hashtag building resilience and hashtag KPIHP, also available on your tables. The restrooms are outside to the left, and then make a quick right down the hall. And in case of an emergency, we'll be walking straight out of these doors and following anybody who looks like they know where they're going. Let's see. Staff, if staff wouldn't mind raising your hand, our staff for the event today are wearing green pins. And so if you have questions throughout the day, please look for someone with a green banner, or you can talk to me as well. We're happy to assist you with whatever you need today and answer your questions. And then for those who think in terms of meal to meal, like I do, lunch is at 12:20. So we'll be working really hard to make sure that we get you fed on time today. There is an opportunity for questions to be asked during each of our panels and for our speakers. And I'll just point out that we have microphones on either end of the rooms. So please, when you feel like you have a question to ask, please feel free to stand up and use the microphones. So before I introduce Dr. Sharon Hoover for her opening remarks, we're going to do a quick poll. A poll everywhere. Folks might be familiar with this. So there is signage on your table, and you can participate via text. So please, this is the first and only time we will ask you to pull your phones out. So you can participate in this by texting Health Policy 261 to 22333. Or you can visit the website that's also available on the card. So text Health Policy 261 to number 22333. So let me give you a second to get started, and then I'll go ahead and pose our first question.
It works.
It works. Looks good. People ready? Okay, so I'm going to go ahead and pose the question, and we'll see if we start seeing some responses come up. So what's something that you're looking forward to getting out of today is our question. So, and we should start to see some results populate, hopefully. Inspiration. Collaborative opportunities, connecting with colleagues, knowledge, ideas, wonderful, insights and innovation. Let me see. I'm in an awkward angle to read these. Collaboration. Better understanding interventions, best practices on resilience and networking, discussion of mental health promotion, not just treatment. Wonderful. Let's see others.
outreach opportunities, expanded or deepened partnerships in this work, learning the future direction of the work, synergy, resources, knowledge. Wonderful. Thank you so much. So I have a second question for you as well. So now that we know that what you're hoping to take out of today, we'd like to hear what you think you can give to today. So let's circle back with a second round of responses on our second question. What is something that you think you can give today? Scalable approaches, attention, experience. Whoa, whoa, whoa. This is exciting. Look. Openness, energy, passion, enthusiasm, open mind. I see. Focus on the resilience of staff, resources, a platform for technology transfer. Wow. K through 12, school mental health, exemplars and resources. Advocacy, great. Wonderful. Insight into military-connected families. Really exciting. Okay. Making linkages. Safe space for honest dialogue. Wonderful. Well, thank you, everybody, for participating in these. And I look forward to hearing the conversation and having you all bring all of these sort of qualities to today's conversation. So with that, I would like to ask Dr. Sharon Hoover to come and join me here on stage. And I will say for the speakers to please watch your step. It's a little wonky. Exactly. Yes, exactly. Okay, so Sharon is a licensed clinical psychologist and associate professor at the University of Maryland School of Medicine in the Division of Child and Adolescent Psychiatry. She's the co-director of the National Center for School Mental Health, where she helps lead their efforts to support states, districts, and schools in the adoption of national performance standards for quality and sustainability of comprehensive school mental health systems. She's led multiple federal and state grants with a commitment to the study and implementation of quality children's mental health services. Welcome, Dr. Hoover.
Okay, thank you so much for the welcome, and I'm grateful to be here and to be with this group as we embark on our own national conference, which starts tomorrow. So I want to start with some thoughts around what it means to be a mental health provider and to support the mental health of our young people. Many of us in the room may be mental health providers of one sort or another, and we often have the privilege of being present with someone as they share their struggles and their hopes and some of the difficult parts of their journey. And for me, I recently had the privilege of talking with a young woman who was talking about some of her earlier childhood years and some of her time actually through adolescence where she was really struggling. She shared some of her journey through adolescence and through some of the challenges with her family, some in her community, but really a lot of stress happening at home, and was speaking in part to things that were happening that were so distressing to her that she, at a few points throughout her high school journey, considered taking her own life. And one of the things she said as she talked about this time, and I should mention she's really flourishing at this point in her life, but when she talked about this point of time, she said, "Dr. Jones saved my life." And I had some assumptions about who Dr. Jones might be, but then she went on to describe who Dr. Jones was, and it turned out that Dr. Jones was her math teacher. And she talked about Dr. Jones being an inspiration to her and being somewhat of a mentor. But one thing she said that stood out to me, you can see it here, Dr. Jones saw me as a human being and made sure that I knew it every single day. And that really resonated with me and stuck with me in terms of the role that many people play in in shaping the life of our young people, including those people in schools. And many of us really work at this intersection of mental health and education. And so it made me think a little bit about, well, who are the mental health providers? Because I think we often think about our psychiatrists, our social workers, our counselors, our psychologists, and others as being the mental health providers. But really, as we sit at this juncture of mental health and education, we're often thinking about who are the natural supports in our young people's environment, whether it be the educators or the school health providers. We do a lot with our school nurses. We know that many of them are the frontline mental health providers for our young people. We also think about some of the family members and how they essentially are the mental health providers for our young people. And we're thinking more carefully these days about peers and the valuable role that they can play as mental health providers. So one of the things that I encourage all of us to do today as we embark on this conversation about trauma and how we see trauma from birth through graduation is to think about who do we mean by mental health providers and how can we all really support mental health of our young people and support those who are in positions of supporting mental health. So I have the privilege of co-directing our National Center for School Mental Health along with Dr. Nancy Lever, who's here with us today. And we have a fabulous team who's running around today in preparation for our national meeting. This is actually the 24th year that we've hosted a National School Mental Health Conference. And we are funded out of the Health Resources and Services Administration to help advance policy and practice and research and training in school mental health to advance success for our nation's youth. If you want to find out a little bit more about what we do, you can find us at schoolmentalhealth.org. And I'll share a couple of resources from our center. But I first want to say that we are always delighted to have partners in this work and to have folks who say that they want to do a pre-conference with us. But I'm particularly excited about today's session and have had the privilege of partnering with Kaiser Permanente for the last 2 years on their Resilience in School Environments, RISE work, which I know you'll hear about today. And it has been an incredible journey with the team to hear about how they have looked at thriving schools over the years and how they've now made this commitment to supporting resilience in school environments as one of their key ways of supporting health and mental health of not only young people, but also the adults that serve young people. So I'm excited for you all to hear about that. If you're not already familiar with the work, it's been a great privilege to work with a lot of the leaders at Kaiser Permanente in this work. So I'll share with you a little bit about our center and then talk about how we see what you're doing today really fitting in with the work of our center. As I mentioned, we've been hosting this work as a national meeting for 24 years. We move around the country in part to help leverage and advance state-level work in school mental health. We'll be in Baltimore next year for our 25th meeting, so we hope to see many of you there. A couple of resources that we are incredibly excited about. The School Health Assessment and Performance Evaluation System is a system that we've put in place from the charge of HRSA to develop national performance standards in school mental health. We just relaunched SHAPE as a way for individuals and schools and districts and now state-level leaders to go in and assess their school mental health system quality and also engage in a process of school mental health quality improvement. And I'll just mention that there's a whole host of bells and whistles in terms of how you can engage with school mental health quality. So you've got a screening and assessment library and a trauma responsive schools implementation assessment, which I'll touch on in a moment. But this is a way that we've been charged with supporting the field to advance school mental health quality. We also have had the privilege of partnering with the Mental Health Technology Transfer Center Network over the past year and a half. If you're not familiar with the MHTTC network, please become familiar with them. I see some of our regional leaders waving. Yay! Waving in the room. So reach out to them. You have a phenomenal support system at the national level, but also regionally as part of SAMHSA's vision to help support technology and knowledge transfer to states to support mental health knowledge transfer. And one of the cool things that they did after they funded these centers was to offer a supplement specifically focused on school mental health. They saw the value and the vision of school mental health as being a part of the system of care for our young people. And so all of these regional centers now have plans and some funding support to leverage the work of school mental health and advance it in their region. As part of this work, we partnered with the National Coordinating Office to develop a national school mental health curriculum for all districts to be able able to take and learn essentially the foundation or the fundamentals of school mental health and put it in place in their district. You can access that at the mhttcnetwork.org site, and it goes through 8 different modules on school mental health advancement. So I encourage you to check that out. The final resource that I want to share with you from our center before moving into the topic for today is this guidance document from the field. Some of you may have seen this. If not, it's available on our website. This is a collaborative effort of about 75 different entities that came together to put into one place what are the core features of school mental health and what are some local and state examples of how this is going well. And so I encourage you to check this out. It's a pretty cool document. So we've been really partnering with this movement around trauma-informed schools probably since our inception, but it's become a bit more of a focus, not only of our center, but many of you in the field have probably been a part of this effort for years now. And the good news is that as we embark on our conversation today, we have a lot to build from and to build into our work. So one of the things that I'd encourage us to think about is how can we not reinvent the wheel? How can we ensure that we are building upon the good work that's out there? There are frameworks for trauma-informed schools that I'm sure many of you are familiar with. There's work that SAMHSA has done, the National Child Traumatic Stress Network. One of my favorite frameworks for trauma-informed schools comes out of Ontario and some of the work that they've done with their First Nations youth, and it's a really great example of youth-driven work to create a trauma-informed framework. So I encourage us to keep those in mind as we embark on this work. One of our partners throughout the trauma-informed work has been the center run by Dr. Marlene Wong out at USC in her work with the National Child Traumatic Stress Network. If you're not familiar with them, I'm sure you've heard of their work, even if you're not familiar with their exact center. But Marlene Wong and her team are the folks that about 20 years ago started looking at, as part of the National Child Traumatic Stress Network, how can we bring trauma interventions and trauma treatments into schools? And so one of the things they did that at the time I think was really remarkable was demonstrate that if we bring treatment to young people who are experiencing post-traumatic stress, if we bring that treatment into the school setting, young people are much more likely to access care, but also to complete care. Some of the data suggests about 6 times more likely to complete that care. So these interventions have been developed and tested over time. They've been adapted. So cognitive behavioral intervention for trauma in schools is one of those interventions, but it's been adapted now for younger students and for delivery by educators and others. And we know there are many interventions now that are being tested for delivery in schools. They recognized that this wasn't enough. We can't just plop interventions into schools and expect them to be trauma-informed, although we've all certainly seen that happen. In terms of that being the only effort. So one of the things that we're seeing more of is this movement towards fully comprehensive systems of trauma-informed schools. This is just the model that came out this past year from the National Child Traumatic Stress Network. If you're not familiar with it, you can Google it, as with most things. And it's again, a multi-tiered system for how can we conceptualize not just serving young people who are experiencing post-traumatic stress, but how do we really create trauma-informed systems? We partnered with that center to develop a trauma-responsive schools implementation assessment, which is available on the SHAPE system. But one of the things that a lot of schools have struggled with in their effort to become trauma-informed is really figuring out where do you start, right? It can feel quite overwhelming, frankly, to become a trauma-informed system. And so what ends up happening sometimes is we see schools doing one assembly on trauma-informed schools or implementing one intervention, and then they check the trauma-informed schools box. And one of the things I think we're going to talk about today is how do we not do that? How do we ensure that we're really being comprehensive, not only in terms of interventions, but how do we sustain those? And again, I'd encourage us not to reinvent the wheel. There are fabulous packages that are out there and resources that can help inform the work. This is one from our partners at the National Center for Safe and Supportive Learning Environments that was supported by the U.S. Department of Education. So there are resources for us to look to as we embark on this journey today. And with that, I want to again welcome you from our National Center for School Mental Health, and then introduce our next speaker. So Dr. Mordecai, I have the privilege of introducing. Dr. Mordecai is Kaiser Permanente's national leader for mental health and wellness. He has been with Kaiser Permanente since 2003. Dr. Mordecai trained at Stanford University School of Medicine in child and adolescent, as well as adult psychiatry. His clinical work has been with patients with developmental disorders, attention deficit hyperactivity disorder, and a range of general psychiatry issues. He sees patients of all ages, though my understanding is that he's particularly interested in working with adolescents and young adults. Dr. Mordecai also serves as adjunct clinical associate professor of psychiatry at Stanford University School of Medicine, and I'd like you to join me in welcoming Dr. Mordecai.
Big step. Good morning, everybody. Thank you. I'm going to grab some water. Thank you, Sharon. Thank you for hosting us at your conference. Congratulations on the 24th year. And Sharon shared with me that the first one you had 100 people or a couple hundred people?
Very small.
So small, a couple hundred people. Tomorrow they expect a couple thousand people. So that's pretty cool that there are so many people who want to come to Austin and talk about school mental health. As a child and adolescent psychiatrist, it's sort of near and dear to my heart. Show of hands, is it near and dear to anybody else's heart here in the... Everybody's hand went up. That's awesome. So I just wanted to make a few remarks. One is, you may wonder, why is Kaiser Permanente, which is a large healthcare organization, wanting to sponsor a pre-conference at the National Center for School Mental Health Conference? And the reason is that we're very invested in thinking about what is the role of a healthcare organization in terms of health upstream, right? And I think you're starting to hear a fair amount of this in society, and I think it's a really important shift, because we've always been about prevention, right? That's sort of part of our DNA, part of our mantra. But I'm not really talking about the kind of prevention that says, oh, hey, you know, your blood sugar's starting to creep up, you're becoming insulin resistant, we need to change your diet and exercise and things like that, although those are really important things. We're really talking about prevention that says that intervention, even before diabetes, is way downstream, right? And what kind of interventions might we apply, really, as a society, upstream to make sure that fewer people ever get to the point where they're at risk for type 2 diabetes, for instance? And of course, you know, we're here today talking about mental health. So what about risk for substance use disorders or suicide or anxiety, depression, things like that? So those are our questions that we're asking ourselves as we look to promote affordable housing, food security, something we're calling social health, which kind of wraps up this very broad area together. And we think at Kaiser Permanente that it's our duty to actually reach beyond our walls as a healthcare organization and kind of rethink what a healthcare organization is. But we get that that's really big and broad, and certainly not something that we can do alone. So partly this is about how do we engage society in this conversation, because right now we're accepting pretty high rates of childhood adverse experiences, for instance, and thereby accepting the downstream impacts of those things. And at some level it feels like a choice. I don't think that's too radical to say, but as a collective society, we're choosing not to make the interventions to prevent these things. So we think we need to change our thinking on that. This is another one of those questions, right? How many people have heard of the Adverse Childhood Experiences Study? Wow, that's so cool. There are very few rooms where I ask that question and everybody raises their hands, I have to say. So as you probably know, in the late 1990s, Kaiser Permanente, along with the Centers for Disease Control, which, by the way, just published something today as a sort of follow-up. They still have an active division devoted to the Adverse Childhood Experiences Study. Completed this study, and there were, basically there were two findings, is what I say. One is adverse childhood experiences are really common, right? And we're talking, as you all know, about things like divorce, parental incarceration, parents with substance use disorders or mental health conditions, domestic abuse, of course, child abuse. These things are really common in our society, disturbingly so. About 60%, 2/3 have had at least one adverse childhood experience. About 1 in 6 have had 4 or more. So that's one, they're common. And two, there's this incredibly strong linear correlation between the number of adverse childhood experiences you had as a child and these downstream mental health effects and physical health effects. And I think that's really important because it gets us out of the silo of just talking about mental health, right? We're talking about mental health and physical health. If you've had 4 or more adverse childhood experiences, twice the risk of heart disease, twice the risk of stroke, and yes, also 7 times the risk of substance use disorder and 12 times the risk of suicide attempt, right? So these things are connected, and we know that, but this study really pointed to that, which I think is part of its importance. We are continuing to push on the adverse childhood experiences research envelope. We just announced a $2.75 million grant to advance research in adverse childhood experiences. We want to look at where the gaps are in our understanding and fund studies that will address that, basic understanding, but also where are the gaps in our understanding of what are the successful interventions that we can apply? Because we're really thinking, what are the interventions that work? How do you scale them? How do you sustain them? Those are key questions, obviously. How are we doing on time, Ceci? Should I try and... Oh, I've got a clock, she says. Look at that. So we've been involved in a number of attempts to address these issues. One is called the Family Violence Prevention Program. It's been around for about 20 years, and it's something that we have worked within our care system with our physicians, mental health providers, nurses, anybody who's touching patients, to help them understand how common domestic abuse is and how to address it. And then more recently, we're moving into newer approaches. So let me talk a little bit about why we thought the National Center for School Mental Health was a great place to do a pre-conference. We are working, as Sharon described, and Sharon's group is doing the evaluation for us for this in the University of Maryland, the Resilience in School Environments program. Sharon shared with you a lot of evidence-based approaches to bring trauma-informed approaches into schools. What Resilience in School Environments is about is more focusing on the staff. A lot of approaches very appropriately focus on kids. That's kind of the obvious, like, well, what are we trying to do? We're trying to have the kids be healthier, right? Well, it turns out that the staff are the ones that see the kids over years and years and years and generations, and often the staff need support. So not only do they need to be taught, like, this is what trauma is and this is how you should respond to it, and kids, they need help with perhaps their own traumatic experiences as kids, but also the trauma that comes from working with kids who've been traumatized, right? So that's where we're intending RISE to come in, which is to really be supportive of the staff. And of course, we believe that schools can offer safe, supportive environments. We all want that. We all know that mantra that even one sort of caring connection can be healing for kids, and we believe that can be teachers. It doesn't have to be a teacher, though. It can be a coach. It can be a school staff member. So when we say staff, we're not just talking teachers either. We're talking teachers, administration, support staff, everybody in the school. Because as Sharon's talk pointed out, you never know who that person's going to be, that a kid says, oh, this person recognizes me as a human being. This is somebody I can go to when I need help. So what we want RISE to do is both be a kind of package, but also a way to be customizable. We are on site in many schools right now. We're looking to be on site in over 200 schools by, somebody give me the date, is it the end of this year? Elisa, the end of this year, which is a heavy lift. And then we want to bring virtual products to people so that we can be in thousands of schools, because we don't think it'd be very difficult to be on the ground in thousands of schools, but if we can reach thousands of schools, that's what we're looking to do. So, whether it's food security, whether it's housing security, whether it's community security, security at schools. We are looking to strengthen our society and our society's ability to take care of our most vulnerable and most important groups, right, which is our kids. It's a huge lift. We cannot do it alone. We have to get together and knit these approaches together if we're going to make a real difference. So that's what I wanted to say. That's what Kaiser Permanente is thinking about, the importance of moving forward in thinking about what healthcare can be and really moving upstream. So now I have the pleasure of introducing Dr. Gary Blau. Gary is our keynote speaker this morning. Dr. Blau is a licensed clinical psychologist and executive director of the Hackett Center for Mental Health, which is the first regional center of the Meadows Mental Health Policy Institute, located right here in the great state of Texas. Where is Gary? I keep looking for him, but I'm not seeing him. There he is. He's holding up his water. He and I had a conversation about hydration earlier this morning. So the center's vision is to position Texas as a national leader in treating people with mental health needs and ensuring that the state's improvements in access and care policies address the unique needs of Greater Houston and the Texas Gulf Coast. Dr. Blau served for 15 years as the chief of child, adolescent, of the chief of the Child and Adolescent and Family Branch at SAMHSA, where he provided national leadership for children's mental health and created systems of care across the United States. He's received several awards for his work, including the Award for Meritorious Service from the Secretary of the Department of Health and Human Services. And he has over 70 publications and has edited 8 books. So another like-minded fellow with this group, child and adolescent oriented. And Gary, if you would come to the podium and take a big step up. I think every transition we have to talk about the step.